Well, KU men's basketball coach Bill Self is in isolation after testing positive for COVID-19. Self says that he got tested after minor symptoms developed. He adds that he is fully vaccinated and he feels pretty good right now. He urges everyone to get vaccinated. He says, "I fully believe that I would be in much worse condition if not for the vaccine." Some people point to breakthrough infections as a reason not to get the vaccine, but doctors say that the shots still help those who get COVID. New tonight, KMBC9's Brian Johnson explains why a recent change from the CDC can help clear up the confusion.
A COVID-19 breakthrough infection is now defined as when a vaccinated person is hospitalized or dies from the disease. Mild or no symptom cases are not counted. The CDC made the change May 1st, it says, to maximize data collection for the benefit of public health.
That kind of makes public health sense. Is vaccination is trying mostly to prevent symptomatic disease from people getting sick, hospitalized, or dying from the illness.
The folks who are coming in the hospital that are vaccinated are people who we don't think responded to the vaccine because they have so much chronic illness.
Cases where a person's body didn't respond to the vaccine, such as folks with heart failure, diabetes, or a recent organ transplant. Doctors say 90% of hospitalizations from COVID-19 are patients who did not get the vaccine.
This is now a pandemic of the unvaccinated, right? It's a pandemic of the unvaccinated.
Doctors say the vaccines are safe and effective and build immunity against COVID-19 variants.
If we get people vaccinated, then we're safe. And the problem is, because so many people are vaccine hesitant or resistant, then we're not safe as a society.
Brian Johnson, KMBC 9 News.
Now, the CDC says breakthrough cases are expected because no vaccine is 100% effective. The St. Louis City and County are going to be requiring masks again in indoor public spaces starting on Monday. Even those who are vaccinated will need to wear a mask. All this comes as the Delta variant continues to spread. And tonight, we just learned that Missouri Attorney General Eric Schmitt says he plans to file a lawsuit Monday to try and block the new mask rules. Schmitt says the citizens of St. Louis and St. Louis County are not subjects. They are free people. In the Kansas City metro, 275 new COVID cases are reported each day. That's on average, and that is 3 times higher than a month ago. This is according to the Mid-America Regional Council. The mayor of Kansas City, Missouri, says it's not the time for another mask mandate. He plans to meet with local health department leaders to talk about whether one could be needed, though. As for now, he encourages masks in crowded indoor areas and when close to unvaccinated people. He says the best way to save lives and beat the pandemic continues to be vaccination. Johnson County, Kansas is still the only county in the metro with a vaccination rate that's higher than 50%. On the Missouri side, Clay County leads the pack there with 41% of people fully vaccinated. A COVID strike team has arrived in Springfield where the Delta variant is surging. The team is made of disaster medical assistance officials. Now, they normally respond to severe weather disasters like tornadoes, but now they're offering monoclonal antibody infusions.
Really, the significance is the state recognizing, it's not well here in Springfield, and it's time to do something before it becomes catastrophic level, and we are calling in the federal government.
Now, the antibody treatments are intended for moderate COVID-19 cases to keep them from becoming severe.